My name is Amos Hamukale from the Zambia Field Epidemiology Training Program. I'll be presenting on SARS CoV-2 mortality surveillance among community deaths brought to the University Teaching Hospital mortuary in Lusaka, Zambia in 2020. Zambia recorded its first case of COVID-19 on 18th March 2020 and its first death from COVID-19 on 2nd April 2020. By December 2020, Zambia had recorded 20,725 confirmed COVID-19 cases. Of these, 388 were COVID-19 related deaths occurring nationwide. Most of the deaths were found to be coming from the community, recorded as BIDs. In Zambia, the true impact of COVID-19 is not known due to the limited testing capacity. Mortality surveillance is a key indicator of overall epidemic impact and trajectory. Hence, in this study, we report findings from COVID-19 mortality surveillance among community deaths at the University Teaching Hospital mortuary in Lusaka. We conducted a cross-sectional study at UTH mortuary of Lusaka, Zambia. The study population included community deaths, commonly known as BIDs, admitted at the University Teaching Hospital mortuary in Lusaka. We abstracted data from the mortuary BID register and SARS CoV-2 testing line list. We defined COVID-19 deaths as the number of persons who died and tested positive for SARS CoV-2. UTH has been testing BIDs for COVID-19 since April 2020. And all BID cases received at the mortuary were tested for SARS CoV-2 whenever resources were available. We analyzed line list of persons BID tested for SARS CoV-2 maintained by ZNPHI. And we also used Spearman's rank-sum test to measure the correlation between SARS CoV-2 % positivity in the general population and SARS CoV-2 % positivity in BIDs. In the analysis of excess mortality, we defined excess mortality as the number of persons BID who died from all causes in excess of the expected number of deaths for a given place and time. We analyzed excess deaths among BIDs at UTH in 2020 January to December 2020, compared to a historic average for 2017 to 2019. We measured excess mortality as the number of deaths above the upper limit of the historic average ranging 2017 to 2019. During 2020, January to December, we recorded a total number of 7,756 BIDs at the UTH mortuary. For our period of during our period of testing, which ranged from April to December, we recorded 6,022 BIDs. The total number tested from the 6,022 was 3,131, which represents 52% of the BIDs received during the period of testing. Of these, we found 212 BIDs positive for SARS CoV-2, which represents 6.8%. We noted that the number of BIDs peaked between June and August 2020. Cases also peaked between June and July 2020, but for the period of August, we did not have the results because no testing was done. When we compared % positivity between the general population and the BIDs, we found a positive correlation of 0.5 RHO, which was significant at p-values less than 0.001. Excess mortality for the period January to December 2020 when compared to the average for 2017 to 2019 we found that the months between June to September and December had recorded excess mortality compared to the average. There was 1,139 excess BIDs from all causes at the UTH mortuary. In conclusion, we found that increase in all-cause BID mortality corresponded with COVID-19 epidemic. SARS-CoV-2 positivity in persons BID is positively correlated to positivity in the general population. Hence, an increase or a decrease in the positivity in SARS-CoV-2 could predict an increase or decrease in the general population. We recommend that combining all-cause mortality and SARS-CoV-2 testing for persons BID provides useful information about the severity of the epidemic in Lusaka, and this should be implemented throughout Zambia for us to understand the real impact of COVID-19 in places where testing is still a challenge. I would like to thank the Ministry of Health, CDC Zambia, ZNPHI, and National Health Research Authority for the support they gave during this investigation. Thank you.